The mystical Vanish. Kissing Nevus managed by a radiofrequency dermabrasion. Nevus, a Latin word for maternal impression or birthmark, indicates a circumscribed, non-neoplastic skin or mucosal lesion usually present at or soon after birth. Melanocytic nevus is a benign proliferation of melanocytic cells which are arranged in nests in epidermis, dermis, or other tissues. Congenital divided nevus of the eyelids, first described in 1919 by Fuchs, is a rare form of the eyelid nevus, usually involving contiguous, equal portions of the unilateral upper and lower eyelid margins. Owing to its extension to the lid margins, the edges of the tumor touch or kiss during the closure of the lids, rendering the name kissing nevus. It is also known as split ocular nevus or panda nevus. Normally during intrauterine 6th week, the lids appear as ectodermal protrusions and grow toward each other and fuse at 24th week, after which they gradually separate. Melanoblasts originate from the neural crest and migrate during 12 to 14 weeks of gestation to colonize the epidermis. During nevus formation, the defect in melanocyte migration produces a split nevus. A similar interesting process of congenital divided nevus has also been described elsewhere in the body, including the penis and between fingers. However, this is much less common than the eyelid. Based on the size, these can be divided into small, less than 1.5 centimeters, medium, 1.5 to 19.9 centimeters, and large, more than 20 centimeters. Based on histology, these are organized into three main categories: junctional, intradermal, and compound type. In course of time, there is a risk of malignant change ranging from 2 to 30% in the nevus, giving rise to melanoma. High index of clinical suspicion is required in pigmented lesions with a history of growth, alteration in pigment pattern, vascularity, and associated inflammation. The surgical management options vary from full thickness excision biopsy followed by lid reconstruction for lesions invading the deeper dermis layer to radiofrequency dermabrasion for lesions limited to the superficial dermis. In this case, after proper aseptic precautions and infiltration of local anesthetic agent, we used monopolar radiofrequency probe parallel to the lesion to gently abrade the superficial dermis layer till the appearance of pinpoint bleeding. Care was taken to avoid lash follicles and the deeper dermis layer. Successive sessions were planned at an interval of 6 to 8 weeks for complete excision. To conclude, radiofrequency dermabrasion gives excellent cosmetic outcomes with minimum morbidity in cases of congenital divided nevus of the eyelid.